Dr. Judith Zackson is a clinical psychologist. She is based in Greenwich, Connecticut. Her private practice focuses on areas including depression, anxiety, panic attacks, relationship issues, parenting issues. The very first area I want to talk about in discussion with you, Dr. Zackson, is this idea of what has become known by the acronym PTSD, post-traumatic stress disorder. Here it is. It's Memorial Day weekend.
Mm-hmm.
It, at least in theory, is a time that we're supposed to give thought to the veterans of this country. Why is it that so many veterans are dealing with PTSD?
I mean, you're in this situation that is chaotic, overwhelming, unpredictable, and your brothers, your comrades, are dying, and the ones that you've been with are gone just from one minute to the other. So it's really hard not to get PTSD. It's really hard to come back and not be affected by it. The real question is, why aren't there better services to get our soldiers to help them when they come back? It's so difficult for most of them when they come back and they have to reintegrate into the normal world. You know, there's first this honeymoon phase when you're reunited with your kids and your wife. You're really happy. But then when that honeymoon phase passes, for most of the soldiers, it's really hard because all those memories, want it or not, it comes right back, and right back when you least want it. When you're playing with your child outside and your child bangs something or throws a ball really hard, that noise can take you right back there. So it's really difficult, I think, not to get PTSD after you've been through that.
What really works?
It's a variety of different treatments for different people. The first thing is to know the underlying is that people have to know that they're not powerless, that we could change our arousal system. We don't need medication to do that. We do have power over it. As you know, today there's a huge movement towards yoga. Everyone is, going to yoga studios and turning themselves into pretzels because people have learned that they could control how they feel, and through yoga, they learn how to breathe better. They learn how to regulate their internal system. So from my point of view, I always teach my clients empowerment. And empowerment can be as simple as taking a self-defense class, doing things that doesn't make you feel powerless. And then from a therapeutic point of view, from traditional therapy, I have my patients recount their experience, because when you find language for your internal chaos and what's going inside you, it normalizes it. Once you are able to communicate with another human being, it takes away its power. And there's a therapy called exposure therapy that is used for PTSD, where you have the person recount their story. And that's really hard for a lot of people. That's the last thing they want to do, is talk about something that is so overwhelming. But if you're able to go there in a safe environment, whether it's with your therapist, with a loved one, it does become better because now you're in a safe place. You're not in this powerless environment. And by talking about it, it makes you feel not alone. The aloneness and the powerlessness are the key factors that keep a person in this traumatic, overwhelmed state. And then cognitive behavioral therapy is knowing that you have control over your emotions. Your thoughts are very powerful. A lot of veterans deal with what's called survivor's guilt. They feel guilty. Why did my why did my comrade die and I didn't? He saved me. Why couldn't I save him? And then helping them look at it logically, because Bob, you and I know that really, it wasn't their fault. I mean, it happened. It was a circumstance, and there is nothing they can do. And we have to help them tease apart the logic, the reality from their emotions and from their guilt. And helping them work through that is really powerful for somebody who struggles with it. Similarly, they also feel guilty being with their families. They feel guilty living pleasure, having fun because of what their buddies can do. So that's a very big thing that we try to work through as well. Then there's a lot of family therapy. A lot of people come to me not because of PTSD per se, but because their wife says, you have to go to therapy because you're not yourself, or you have a lot of anger issues, or they're violent. So they come to therapy, and we do family therapy. A is to educate the spouse on how to be with the victim, because the person who has PTSD is very delicate, and you can't push them too hard to be with you when they can't be with you, when they're in another space. So teaching the spouse or the other family members how to help someone who's suffering from PTSD recover again. So this is part of all of the therapeutic treatments that are done.